I'm Jack, and this presentation is on the application and features of telemedicine. So firstly, an introduction. What is telemedicine? Telemedicine is the remote diagnosis and treatment of patients by means of telecommunications technology, which could be anything from telephones to video calls. What's it used for? It's used for quick and convenient contact with patients in order to discuss treatments and future plans without the need for face-to-face contact. Why did we start using it? It was initially implemented to take the stress off the healthcare service by providing a more convenient treatment method. However, during COVID, the uptake of these services was massively sped up due to the need for reducing infection rates. And why should we keep using it? Since its large-scale introduction during COVID, lots of research has been done on patient satisfaction and the efficacy of telemedicine. And this has found that in most cases, patients were satisfied with the care they received. And this, coupled with the fact that it has a lower cost and is more convenient, have led to the decision by the NHS to keep using this developing technology. So these are some of the different applications of telemedicine. Firstly, GP appointments. Lots of GP surgeries are now offering a telephone call instead of an in-person meeting if the patient feels their problem can be solved over the phone and they wish to save some time. Secondly, telemedicine allows patients to undergo preliminary screenings or consultations from the comfort of their own homes. And by sharing this medical history and symptoms remotely, it enables doctors to better be able to prepare for their in-person visit. It's also very useful for repeat checkups for chronic patients. Regular follow-ups are essential for managing chronic conditions, where they often demand extensive travel and inconvenience for patients. And telemedicine allows patients to receive their care more conveniently, again, from their own home. Can also be used for general medical advice, which traditionally may require a trip to the GP, but is now accessible through telemedicine. Patients can seek trustworthy medical opinions without leaving their homes, ensuring timely advice for minor ailments, medication queries, and even general health concerns. It's also aided secondary care, as doctors have been able to perform their clinics over the phone, which saves them time and allows them to communicate with more patients per day. So now let's look at some of the pros of telemedicine. Firstly, cost. Telemedicine offers a more affordable healthcare option for patients as it eliminates travel expenses and reduces time off from work. Additionally, for the NHS, telemedicine can help in optimizing resources and reducing unnecessary hospital visits, as well as improving overall cost efficiency. Moving on to efficiency and convenience. With telemedicine, patients can schedule virtual appointments, which can eliminate the need for long wait times. This not only saves time, but also helps reduce overcrowding in clinics. Moreover, telemedicine allows healthcare professionals to efficiently manage their time, providing more personalized care for each patient. It also helps to alleviate stress among healthcare staff. By leveraging technology, healthcare providers can effectively manage and prioritize patients, leading to reduced workloads and improved overall job satisfaction. This proactive approach results in better patient outcomes and increased staff well-being. Obviously, let's not forget about the environment. It significantly reduces carbon emissions by replacing unnecessary travel and commuting associated with in-person visits, which means that by embracing telemedicine, we can positively impact the environment. And last but not least, telemedicine provides high levels of patient satisfaction, whether that be due to the convenience, the minimized wait times, or the ability to interact with healthcare professionals remotely. Telemedicine consistently receives positive feedback from patients. It's able to enhance the patient experience while ensuring quality healthcare delivery. Now let's cover the cons. So the first challenge is the inability to examine patients in person. One of the unique aspects of traditional healthcare is the physical examination, allowing doctors to gather crucial information for accurate diagnoses. However, with telemedicine, this personal touch can be somewhat limited. The second challenge we encounter is misdiagnosis and safety concerns. So a study published recently in the BMJ on telemedicine found that in several instances, unnecessary harm or death had occurred, which was related to telemedicine. And this was due to several reasons, including a lack of proper protocol and training. Another key challenge is the difficulty in reading body language. So non-verbal cues such as facial expressions and body gestures play a significant role in effective communication. Unfortunately, these can be very challenging to interpret on telemedicine consultations, particularly when you've got poor connection, which can potentially affect accurate diagnosis and the doctor-patient relationship. It also presents reduced access or reduced accessibility for certain groups. Firstly, the technologically illiterate may find it challenging to navigate the digital tools necessary for remote consultations, so they may find it difficult to log on to their meetings or similar. And secondly, individuals from lower socioeconomic backgrounds may face financial limitations or lack the proper infrastructure, making quality telemedicine services less available. So let's look at some of the areas where it's been most successful. In rural areas, access to healthcare is often limited due to long distance and a lack of healthcare facilities. However, telemedicine is bridging this gap by connecting patients and healthcare providers through virtual platforms. One area where it's been particularly successful is mental health support. Accessible mental health services are often scarce, leading to individuals not receiving the care they need. Telemedicine allows patients to consult with mental health professionals through video conferences, providing convenient access to therapy sessions and counselling, which can improve overall mental well-being. It's also proven beneficial in chronic disease management. So patients living with chronic conditions such as diabetes or heart disease really require regular monitoring and follow-ups with healthcare providers. And telemedicine enables patients to communicate with their healthcare team remotely, reducing the need for frequent travel. It also facilitates timely adjustment of treatment plans, ultimately improving outcomes and reducing hospital readmissions. Lastly, telemedicine has revolutionised remote monitoring and home-based care. Patients who are unable to visit a healthcare facility regularly, such as the elderly or those with mobility limitations, can now receive necessary care right from their own home. Healthcare professionals can remotely monitor vital signs, provide medication management, and offer guidance on self-care, enabling patients to take control of their own health. So there are also some areas where telemedicine is not as effective. So firstly, areas of poor internet connection. Reliable internet connection is a crucial requirement for telemedicine. Unfortunately, not all communities have access to high-speed internet, which can hinder their ability to benefit from remote care. However, it's important to emphasise the urgency of bridging this gap and ensuring equitable access to healthcare for all. Secondly, language barriers. So telemedicine requires heavily on effective communication between patients and healthcare professionals. And when language barriers exist, it can be challenging to accurately convey symptoms, medical history, and obtain proper understanding. In order to combat this, we need to prioritise the development and implementation of language assistance tools and services to address this issue, along with always maintaining the option for in-person visits. Thirdly, diagnosing people with complex medical issues. Although telemedicine has become increasingly advanced, limitations of remote care still persist, especially with complex medical issues. Certain conditions may require detailed physical examinations or specialised diagnostic tests, which can't be replicated remotely. And therefore, healthcare providers should collaborate with patients to determine the most appropriate course of action, while making sure they always have access to all necessary healthcare. Lastly, we should address the challenges faced by specific specialties like dermatology and paediatrics, because these fields rely heavily on visual examination and physical interactions, making remote care much more challenging. And as we move forward, it's crucial to provide options for patients if they feel they need in-person care to ensure accurate diagnoses and personalised treatment. Recently, a very interesting BMJ article has come out, which covers the safety of remote primary care. The article focused on rare harms which are associated with remote care and general safety practices within surgeries. It found that over the past several years, only 95 safety incidents were recorded for sort of being down to remote care, which does suggest they are rare. It also identified where the key risks lie, and that included resource shortages and understaffing, as well as complex, hard-to-follow care pathways. The safety instances that involved death or serious harm were often a result of a combination of factors, which included poor rapport building, inadequate information gathering, limited clinical assessment, wrong algorithm being used, and failure to take account of social circumstances, which often led to missed, inaccurate, or delayed diagnoses and an underestimation of severity or urgency, among other things. It also highlighted the lack of quality training specifically for telemedicine, with many in-house clinicians having never been formally taught to consult by telephone. So what's going to happen in the future with telemedicine? So acknowledging that no system is perfect, the NHS is dedicated to addressing any flaws in online services. By actively working on refining and improving these services, they can ensure a seamless experience for both healthcare providers and patients. Over time, there'll probably be a significant shift towards online care as technology continues to evolve and better safety protocols are put in place. Telemedicine will become more widely accepted, and an increasing number of healthcare services will be provided online. But by embracing this change, we can improve accessibility and efficiency, benefiting all patients throughout the country. Furthermore, it's important to understand the value of patients' time. As part of a commitment to convenience, every patient will have the option for a quick phone call. And by utilising this option, patients will be able to receive timely medical advice without the need for unnecessary appointments, helping to streamline the healthcare process. The NHS has also taken a significant step forward in revolutionising healthcare by investing £500 million in technology, specifically aiming to enhance primary care. And part of this investment is dedicated to improving technology within GP surgeries across the countries, which will enhance these online services. So in conclusion, telemedicine provides a unique opportunity to revolutionise healthcare delivery and fix some of the problems with the current inefficient system. It can be used to provide improved access to healthcare, reduce costs, and provide better patient outcomes. However, there are still challenges with infrastructure and accessibility which need to be worked on. It should also be stressed that telemedicine should never replace in-person care. It should be used to supplement it. And as with any new technology, it's important to balance the pros and cons and give patients more control over the delivery of their healthcare. So these are some of the references that they're not all directly quoted in the presentation, but they're used to sort of formulate it. And is there any questions?
Thank you very much indeed, Jack. Very good presentation. Do you think you could if you unshare your screen, then I can, if people could indicate if they want to ask questions. Judith.
Thank you very much for that. I was particularly interested in the mental health situation. I am a carer, and I have known so many people with severe mental health problems. I don't know anybody who's been able to get help really through IT systems, whether it's beating the blues or some sort of more sophisticated system. Lots of people develop mental health conditions, so-called, diagnosed that way anyway. So they've been really severely abused. And it's building up when their self-confidence is completely shattered to the point that they cannot leave their own rooms. They need to build up a system of trust again with people, and you can't do this through IT. There is a certain way in which it's useful, where they can contact similar people with similar conditions now internationally, and that can be some support. But actually resolving some of their very serious issues, if they're to ever become part of mainstream society again, is going to need one-to-one care with someone who really knows what they're doing.
Thank you, Judith. Does any comments, Jack?
Yeah, so I think that was so those mental health services are like they're not often meant to be like the sole solution online. They're just meant to be like sort of additional help which can be provided. So for example, like if you like just needed to talk to someone, then you can get on with those online mental health services with a trained professional. And obviously it's not going to ever fully replace sitting in a room one-on-one with someone who truly understands what's happening. But it's just a helpful addition, especially when especially during like lockdowns and stuff where people were unable to leave their houses. It was just one of the measures that was added, which I think from what I've read did really help some people.
Yeah. Okay, any other quick questions for Jack? I'm just conscious of the time. Okay, thank you, Jack.